to another online community forum with the Mustard Seed Project. Please note that this live presentation will be recorded and viewable via our Facebook page and our YouTube channel. All Zoom attendees are requested to remain muted during the presentation. Questions can be submitted via the chat box on both Zoom and Facebook. A live discussion with Q&A will be available at the end. And I'd like to now introduce Eric Blegan, Executive Director of the Mustard Seed Project.
Thank you, Heather. Welcome, everybody. Thank you for joining us today. Just a few words about the Mustard Seed Project. You know, our mission is really to serve seniors, to help seniors age in place in their homes. And so we provide a variety of programs that support that: transportation, home repairs, yard care. And then we have classes and other offerings at our Crandall Center. And we're also getting ready, I was just sharing with our guest, Ben Paganelli, to break ground this month for our assisted living project in Key Center. So we're very excited about that. And we're really excited to have Ben with us here today. Susan is not able to be here, but Ben and Susan formed the Key Peninsula Partnership for a Healthy Community. I believe you started in 2015, and they are the co-executive directors of that. And they really, the name kind of says it. They bring folks together in partnership to the benefit of the community, and making sure that agencies are working together and coordinating our efforts and all of that to the benefit and for the health of the KP community. So with that, I want to introduce Ben. And please remember, Heather, as Heather said, you'll have a chance to ask questions at the end and have a discussion too. So Ben, take it away.
Thanks, Eric, and thanks, Heather. It's a pleasure to be with you folks this afternoon. We've worked with a lot of you, and for those, it's good to be with you again. Those of you who we haven't, we look forward to your conversation today, hopefully questions, and we look forward to working with you in the future. I'd like to share my screen here very quickly and get to my presentation today. I don't want to take up too much of your time with the presentation, because I would hope that you have some questions and we can make this more of a discussion more than just a one-way conversation. So this is our organization that Eric mentioned, and what we'd like to chat about today, what I'd like to chat with you about, is the power of connected communities. And there's tremendous power in the connection, and we're happy to talk about it with you today. You may have seen this logo around the KP, that this is our logo, and I think the mission statement goes directly to what we're talking about today, because this as Eric said, this is what we do. Our nonprofit, 501c3 pending, is about strengthening the KP. We work with organizations who are off the KP, but only to the extent that we're trying to support their work on the KP. And we do it by connecting. When I say we, Eric referred to Susan, my much better half. She sends her apologies. She and I were supposed to give this presentation. Her folks have a couple of procedures that came up today, medical procedures. And as we all know, anyone involved in the mustard seed, aging in place has its challenges, especially now with COVID. You get an appointment, and unfortunately, you don't know when you're going to get it again. Sometimes you need help getting there, and sometimes you need help while you're there. And so Susan sends her regrets. You would rather have her here with me. She's a much better presenter than I am, but I'll do the best I can without her. When I say we, I also referring to, we have a board of directors, formerly known as our steering committee before we developed our own nonprofit on it. And it's made up of pillars in the community. One of the founding members of the steering committee was Edie Morgan, and it made up of 7 members. You probably know a lot of them. And Dana Webster serves as an ex officio advisor on it as well. And they're volunteer community members with KP. We have 3 focus areas that we're not limited to, but that we have been asked to try to look at and help improve on the work with and develop on the Key Peninsula. That's health and wellness, and that committee is chaired by your very own Sarah Thompson. Hunger Committee And we were just talking at the beginning of this, or before we started, about things like community gardens and other ways to deal with food issues and how to provide for it, increase the provision. And transportation is our third. And that committee has been chaired in the past by Mary Morris. It's built on a lot of the work that the Mustard Seed Project has done in the past. Other members on it include the Red Barn and KP School Bus Connects, which of course has its origins with the mustard seed. So Jen Davis currently serves on that committee with us. It does great work, and we're all, it's all about trying to figure out ways to increase the resources, transportation resources on the KP. Another group, overlapping group that is part of our partnership is a fairly new term, community health workers. And the community health workers are nonprofits and people, churches on the KP who are trusted agents in the community. Folks who have been working for the community, with the community for years, that the people in the community look up to and trust and go to for assistance. And it's a particular project that we've been involved with with the health department. And this is the Community Health Workers Project. And it's about strengthening these organizations through working together and providing additional financial resources to those partners, including the mustard seed, community services, et cetera. And so all of our partners who are doing that are partnership people, as we'd like to say. And then, like any good nonprofit, when we can find willing community members who have a passion about the work we're doing, we love to bring them on board and use them, work with them, and use the talents that they have in the ways that they have passion for. So that's who we are as partnership people. And what we're going to talk about today, I'm going to keep it to 3 fairly simple topics. Some discussion of healthy community, because that's a big term. Community connections, and kind of a theoretical, how the thought process behind it works, but quickly get to examples of what connected looks like on the KP. So I'd like to throw this definition out, and if you want to take notes on it, if you don't like it, happy to talk more about it in the question and answer. But this is a definition that we use to say, what are we looking for? What is a healthy community? And I think we see it a lot on the Key Peninsula. The first one, I think most of us will agree, takes pride in helping itself. You would not be in this discussion right now if you were not interested in helping other people in your community. I'm sorry, was I muted there? I apologize if I was. You would not be involved if you were not interested in helping the community. And it's really important, I think, you'll see if a community loses that pride in itself. I think we've seen communities that happens. It does definitely affect how healthy that community is. A healthy community is connected, and we'll get more to that in just a few minutes. And then finally, a healthy community defines itself by strengths, not by what it needs. And that brings me, it's a great segue into, okay, next slide, there we go. What we refer to as an asset-based approach versus a need-based approach. When we started this project, we were asked to work with a really good model, the Healthy Community Model, which was developed out of Northwestern University. And it's a very powerful model on working in community organization and development. And they've done a lot of research, they've proven a lot of things, and they've got an interesting approach in that the concept of not being needs-based. And I want us to think about that for a second. For probably recorded history, at least since the New Testament, we think in terms of helping people, finding out what they need. If they're hungry, feed them. If they're poor, provide wealth or shelter. We think in terms of, I want to go help people. Those people need this help, and they need me. And that is not inherently a bad thing. It's what we have done for millennia. And it's a great concept. But I'd like us to think a little bit more about a better approach to that. And that's, come out of this model and this work at Northwestern. And it's the asset-based approach, because in a lot of ways, if you are needs-based, it's kind of like walking up to someone on the street and saying, "What's your problem?" And most of us don't think in terms of that. We walk up, we say, "How are you doing? How are you?" We want to celebrate the good things in their lives and their strengths and their successes. And that's with a healthy person. Now, if you walk into someone who is in the critical care unit, then you have a tendency more to say, "Oh, what happened? What's wrong?" And that's not a healthy person. That's someone who's ill. And so if you base things on need, then first of all, a lot of times you'll come into a community as an outsider, especially, and say, "I want to fix you." Well, we're not broken. The Key Peninsula is not broken. Can we be stronger? Can we reach goals? Sure. Are we broken? No, thank you. I don't need that type of approach. And in all reality, if I become a beggar and just constantly say what I need, I'm not necessarily taking action to build on what I want to build on, to be better. And so the asset-based approach tries to get away from fixing, and it starts with walking a mile or so, being with your community and understanding the community and its strengths and its interests, and getting to know the community. And once you've listened for quite a while, then you can take on the next two steps: building a community vision. Where do we want to be? Where do we want to go? And what do we have to start with? That we have to know, it's called asset mapping, or what we have. And so once you've got that together, then it's just kind of a simple step to take those resources and grow the resources towards the vision. And that's the asset-based approach. There's a little bit more to it, but that's a pretty broad stroke, and that's the key concepts. And that's what we work off of. Okay, so what does that mean in terms of connection? Well, I told you I'd get back to that. We said health community is connected. Some of you may be old enough to remember the old Ritz cracker commercials. Ritz, we're no ordinary cracker. Well, the partnership and this connection concept is a little different. It's it is not the direct service provider that, say, the Mustard Seed, Angel Guild, Children's Home Society, Community Services. That's not what the connection piece is about. What we do in the partnership, as Eric says, we connect, but the service providers are the grassroots, the folks who are in there day in, day out, who are actually, and most of you are probably either volunteers or staff members in one of these. You're getting your hands dirty, you're up to your elbows, you're helping people find food, shelter, doing all the things, building the resources, growing the resources. You're doing that day in and day out. We don't do that as much. What we do is we help you, we support you, we enrich what you're doing, we connect you with other people who are doing similar but different. Or if you're doing similar things, we connect you so that maybe you can overlap a little bit less and build in other areas. So that's kind of the difference of what we do. And it's kind of hard to explain sometimes. People say, "How many people do you feed in a week? How many adults do you transport in a week?" And our answer is we don't, but we try really hard to help Mustard Seed transport people, or for Bischoff to help them feed people, or Community Services Food Bank. So that's kind of where we're at. And so let's dig into that just a little bit more. How do we complement each other? Folks in the Mustard Seed have spent years working on connecting with their clients, but listening to them, reaching out to them, developing programs, working towards an assisted living facility. These are all very important and very focused, but they're expertise. They're areas that, as Eric said in the beginning of this, focused on helping folks age in place, seniors, and programs for them. Mustard Seed doesn't try to have expertise in childcare, particularly, and that's okay. But it's, as Eric and your board doesn't want you to, and we get that. So the expertise is usually very focused in the service providers for good reason. And for us, it's kind of just the opposite. Our expertise is in researching what's out there, in connecting, making connections with those people who are out there, in putting pieces of the puzzle together that will allow people to be more successful. It's a different expertise. And that's why we say it's complementary as opposed to competition or similar. And our focus is very different. If we see, and when we see the mustard seed is clicking on all cylinders in a particular area, we say, great, we need to look less at that, and we need to focus on how we can support them in other ways, or how other organizations can benefit from what mustard seeds already do. And so it's really almost whatever the service providers are doing, we want to be reactive and be able to fill in the gaps and the pieces that aren't what they're doing. The more powerful the direct service provider is, the more we want to back off and find other ways or other avenues, and vice versa. And so what kind of value does that bring? I'll throw out, first of all, continuity. In the 6 years that we've been around, literally every major service provider on the Peninsula has had some leadership change at some level, which is as it should be, and it's normal. We can serve, and we often do, is introducing new leadership to some of the players on the KP, sharing with them some of the history, being able to provide some background and context and things that have been done. We're persistent. We've been around 6 years, and when we go to different organizations or funders or the government and say, you want to do this and this on the KP, we sit there and say, you don't want to do it yet? Well, we're going to be around in 6 months, 12 months, and we'll help you do it then. And by the way, we're willing to help you set up networks in advance so that it'll be easier when you're ready to come in and help. And we'll give you an example. I'll give you an example of that in a few minutes. As I mentioned, we serve to fill gaps. We work with Jen, and before her, Mary, all the time on things, and I'll talk about our gas card program, but hey, these folks don't quite fit into our criteria. How do we fill the gap on that? And because we don't work in just one field, and we have a very broad mission statement connecting the community, we can be flexible and go in areas that other organizations might not be able to shift into. And again, we can do that fairly with some agility in a fairly agile way, because we're a small organization, and we can fill that gap for a little bit and then back out if we need to. And so those are some of the values of this connection, is that we're not trying to build our own place, but to connect the organizations as they work together in order to build their places. And so I promised I'd get to, that's great in terms of theory, but what does it mean? Well, I've mentioned the community health workers program. And as I said, it's through the health department. And what we're able to do is the health department contract that we bid for and signed with the health department, is that members of the KP community will work to refer community members to needed resources. And some of that will include outreach relative to COVID, education and outreach for people who want to know more and perhaps be involved in vaccinations and things like that. And in doing so, what we've done is we asked beforehand, we asked our partners on the Key Peninsula, would you be willing to participate in this program? And they all said yes. However, at the time, and a few have not been able to join us on it, but they said at the time, yes, we are willing, but we can't really put a bid in for that project. We've got other things we're focused on. We said, okay, we can put the bid in on behalf of all of us. And so it's about 10 organizations now that are active in this project. And whenever they refer, in the course of their normal work, being trusted agents on the Key Peninsula, when they refer people to other agencies or resources or help in any way, then we can log that as community health worker hours, and we can reimburse those partner organizations for the time spent. And so in a way, we're getting, in a way that would not have been done if we didn't have a connection of the 10 organizations together in a single paperwork type of center, we're able to reimburse Mustard Seed Community Services and churches and things for the work they're already doing so that they can be stronger and continue their work in a more healthy way. So that's kind of the community health worker program in a nutshell. We work closely with the Rotary Clubs of Gig Harbor, and through them, we been able to provide additional resources to the parks, to Mustard Seed, to Angel Guild, to community services, and to Children's Home Society. And again, it's just a function of those resources are out there. They just need to be connected to the right people who could benefit from those resources. We purchased a license for a database for fundraising, and we can purchase the one license and share it with any organization on the Key Peninsula that wants to use that database to find fundraising resources. And KP News was able to do that. We share the password and the username, and therefore, instead of having to purchase 10 licenses and no one knows how to use it, we've got a single source at cost of one, as an example, and people can combine and talk with each other and figure out, how they can use that to support their own institutions. The transportation work, Mustard Seed has been big in that, the keystone for years, and we have a transportation committee, as I mentioned. Information sharing in addition to the database, we print up health and wellness guides and transportation guides, and we're constantly updating those and looking for feedback on it. And Susan prints out, if you don't have it, let us know. We can get you on the mailing list. She sends out twice a week a community update that started with the COVID pandemic, and it's built to present information and resources that are out there in a timely manner that can be used, and they're all relevant to the Key Peninsula. And then one of my last slides, an example of the power of connecting the community. We connected early on with Medical Teams International, and they had a dental van, but they had no place on the Key Peninsula where they knew of that they could set it up. And so we coordinated with the KP Community Services, and they said, sure, they can use our parking lot. And then we said, but we need somebody to administer the program. And we got a great volunteer to jump in and set up appointments and things like that. To kind of work through the scheduling and assist the volunteers. And then we were able to help get some dentists to help man the van. And other people heard about that. And so they said, well, Pierce County Dental Foundation said, can you do a dental clinic? We said, absolutely. We combined Medical Teams International and the folks from Community Services and our volunteer. And we went to the Lutheran Church, and they said, yes, we can have the clinic here. And Bates College came, and I think we did something like $70,000 worth of dental work for free over a 2-day period. And we didn't do any of it. We did not get into a single person's mouth. The community did it. We were just able to connect the pieces in order to provide that. And I know I'm running, I don't want to take up too much of your time. These last couple, again, out of the work of the Mustard Seed and the Transportation Committee, there are gaps. And so we've created a gas card program that we don't give gas cards out to people. We give the gas cards to the Mustard Seed and to the Lutheran Church and to various folks who have the Key Free Clinic, who have clients who could use thousands of dollars of free medical care if they could only get somewhere, and they can't get somewhere. And so we created the gas card program to allow our partners to be able to connect the transportation piece that is not part of what they normally do, with the exception of Mustard Seed, of course. Access to care. Several years ago, we started looking at Dr. Rose and his impending retirement at some distant time in the future. And we started working with a couple of organizations. And while we did not bring community health services to the Key Medical Center, we got them involved in the talks. We approached them and we said, how can we bring the community to support you? And in doing so, we also got Peninsula Community Health Services to say, this is interesting, that we've been wanting to do that. And we started the conversation and we said, how can we help? How can the community help you be here? And how can we build on your resources when you get there? And they said, yeah, I think we will. We do want to come. And now we've got two community health services that we didn't have before, and they're going to grow and bring great resources. And then, just last, and one of the least is funding organizations come and say, who does senior care? Who does food? And since there's a resource they can go to that connects all of these groups, we can say, please talk to Eric, or please talk to Willow, or please talk to Gina. And we've been able to connect a number of large funders and small funders to those organizations because we're around and we can connect and then therefore support the organizations that need it. So those are some of the examples of what power connected community can bring. And I've done way more talking than I would like. And so I hope the time's right. And I hope that a few of you may have some questions. And thanks for this opportunity to speak. I really appreciate it.
Hey, thank you, Ben. Wow, that's a great presentation, and it's clear how you fulfill your mission, making all those connections and how important that is. I really appreciate too the asset-based approach as opposed to the need-based approach. That's a really good distinction, I think. Heather, do we have any questions from Facebook for Ben?
I am looking now. I do not have any questions. And I had a list of questions, but you answered all of them during that fabulous presentation. One thing I will note is that I got to attend the dental clinic and it was impressive. It was really amazing. So thank you for putting that on and for everything that you all do here in the community. Anybody on Zoom here have any questions? We got some great staff members and a board member. And
if I may, real quickly, Eric, one of the things you said about the asset based, and to put it into a concrete example, if the mustard seed was really truly needs based, then they would hire you based on how well you can beg for money and not whether or not you can get things done. Because in a needs based, reality is the more needs you have, the more ways you can explain to funders why you need money. But it doesn't necessarily support any of the good work you're actually doing, because you're going to be successful if you can bring in $1 million independent of whether or not you're actually getting things done. You just have to be a rainmaker. And reality is we all need money to be funded to do what we do. And it is really important. But you and your staff bring so much more. I mean, that's just a function. And Marion does a great job with your support, but you do so much more, and that's the asset.
And I think that asset-based approach lends itself to being more effective, because what the assets in the community are, given your unique perspective, your and Susan's perspective. So that is hugely helpful and valuable. Maureen, did you have a question there? It looked like you did.
Yeah, I just wondered if Ben could expand a little bit more for the people that really don't know anything about it on the community health worker program that's fairly new. And for instance, we just had the mammogram mobile unit here, and it was here all day. We had 28 confirmed appointments and several walk-ins, and just give us a little bit more expanded view of that program.
Sure. And like Heather referred to in terms of the dental clinic, it's not that we, like I said, climbed into anybody's mouth. It didn't set up the van, and we didn't do that. It is about the community. The community gets together, and it was Lutheran Church and community services, and Mustard Seed helped get word out. Well, what you're saying, Maureen, about those events, when we started mapping the KP, we found there's a ton of stuff going on. There's a lot of people doing great work, and there's a lot of I can't count how many times we heard, I didn't know that was out there. I didn't know that was there. I didn't know those folks were doing that. And it's great to build 1,000 new projects, but it's a lot more efficient if we can refer people to 200 projects that are currently up and running, and we don't have to make new ones. Mustard Seed is one of those projects, and Mustard Seed does a lot of referring people to other organizations and other resources. The whole idea of the community health workers is that you guys are out there, and you're able to support that program, those programs you just had. And if you're aware of the programs that are out there that other organizations are doing, then you're more than happy to refer your clients to those services that they can use. And so the Community Health Workers Project is about improving our resources, but it's more, or at least equally, about helping you get word out, because you're the ones who have that trusted relationship with your folks. And you can work with them and say, if you have the funding support and the time and all the things you need to do your job really well, then you can connect. And so this CHW, or Community Health Workers Network, is really what it is about us getting some funding to the community to support your ability, and everyone else involved's ability to be able to do that. And it's a pretty efficient way of using money, instead of trying to build things from scratch, but just improving that flow of communication. And another aspect of it is we need to hear people in our community. And again, if you're trusted as the Mustard Seed is, and Angel Guild, then you do hear. You hear what's going on. You hear what people, where their successes are, and where they're a little short, and things like that. And you can communicate that back up to the health department. Listening is so important, and hearing what our community needs, has to say, cares about, their vision is so important. And there's no better ear to the ground than these partner organizations, such as yourself. And so if we can strengthen you through this program, if the health department can strengthen our community network through this program, then it's a big win. And that's what this project's about. And right now it's funded to the end of the calendar year. We'll see what happens next year.
I just
Did
have
that
sort
answer
of
your question, Maureen?
I just had sort of a general question, Ben. I mean, in terms of, you have such a broad perspective on what's going on in the community, and what is most on your mind? Of course, we're all thinking about the Delta variant and what's happening with that, but what is most on your mind right now? Is there anything that the Mustard Seed could do that would be more helpful than what we're doing already? Just a kind of a general question about that.
Yeah, I'm basically gonna chicken out, but I'd like to think it's a wise cowardice. I would never tell the Mustard Seed what they can do better. You're a great organization, and you're a group of professionals in your organization. So I'm not going to bite on that one, Eric. I'm not going to tell you what you guys need to do better or be thinking about. I can tell you some of the conversations that we've had, and that first part of your question, what am I thinking about? Mental health is really big on our mind in a lot of ways. A lot of identification of mental health issues, recognition, and support networks have gone away during, for social distancing reasons during the pandemic. The amount of spousal and child abuse, for instance, is way down. Well, we don't think it's because necessarily that people have been happier during the pandemic and less depressed and had less mental health issues. It's that the numbers are just not being reported because the people who are there to help or to notice or to, those programs have been shut down or at least dialed back. So we don't know the nature or how deep the issue really is or isn't. But we certainly want to build mental health resources on the Key Peninsula as much as we can, because there are some good providers. There are a lot of people who care. There's a lot of really good programs out there. How can we expand those and maybe provide more resources to other folks? And that's not specifically the Mustard Seed Project. And I know you do have some programs. Certainly, almost all of your programs support positive mental health. So it does include you. But I certainly, wouldn't make a suggestion on how you can work on that or help. But we think it's a very real issue.
Yeah, I think you're absolutely right, and you're right too. It's hard to identify exactly what the issues are and who's experiencing them because of the very nature of what the pandemic has been. As you said very well. Anybody else have a question for Ben? They'd like to ask. Maureen, yeah.
Not really a question, just further on that topic. I'm not sure if enough people are aware that there is a pain and addiction support group that meets at the Mustard Seed on Saturday evenings at 6 o'clock. And I'm sure they would welcome anyone that wanted to drop by.
That is fantastic. Unfortunately, I lost a young man that I had coached lacrosse with years ago. He was just recovering from an addiction and had a good support network. And right at the beginning of the pandemic, a lot of that closed down, including the job that he had and some of his support network. and unfortunately he overdosed. So I really appreciate you guys doing that. That's huge.
I will get you the contact information for the man that runs it, and they have people attending live, and they also have the ability to have people Zoom in. So I'll get you that information.
Thank you, Maureen.
Thank you, Ben. It's been a pleasure having you here today. Thank you for the good work that you and Susan do. Really appreciate it. And we'd love to have you back sometime, maybe a few months, and we check in again.
Well, I look forward to the groundbreaking and where you're going with that. And I hope that just serves as another foundation to connect the community a little bit more. And I'm sure it will. And we got a lot of projects to work on together. So I look forward to seeing you guys more in the future.
Here, here. Thank you, Ben.